All states and territories across Australia have seen a rise in COVID-19 infections in recent weeks. So, should you be worried? Here's what you need to know. In the week ending 30th of October, 7,277 cases of COVID-19 were reported across Australia, an average of 1,032 cases each day. This is a rise of 11.8% from the previous week. According to Mater Health's Director of Infectious Diseases, Dr. Paul Griffin, the current Omicron subvariants in circulation are EG5 and BA 2.86. New South Wales Health's Director of Communicable Diseases, Christine Selvey, told ABC News, "Nobody has a crystal ball, but the modelling that we do have suggests that the increase will continue up through and into December." Dr. Griffin believes the reason for the new wave is that we've seen another significant change in the virus. Each time the virus changes, the protection that we have from past infection and vaccination declines, and that allows the virus to transmit more readily. Professor Adrian Esterman, an expert in epidemiology at the University of South Australia, told Yahoo News Australia only a very small percentage of the population is up to date with their vaccinations. He said, "For most Australians, it doesn't really matter. They're not really a huge risk. But for the elderly population, that's over 65s, only 40% are up to date with their vaccinations, and that is a worry." So, should you be concerned? For the vast majority of Australians, Professor Esterman says the new wave is nothing to worry about. However, high-risk individuals should take extra care and consider another booster. Chair of Epidemiology at Deakin University, Professor Catherine Bennett, says to remember we've been here before. She said, "With each wave, our population-level immunity is helping us get through that wave in a safer way than we have in the previous wave. But we still have to remember that people can become very unwell and we're still losing lives." Dr. Griffin added that as for lockdowns and border restrictions, we shouldn't worry. Instead, the message we should get out there for people is that the virus will continue to change. So, what next? For people who are particularly vulnerable, if they haven't had their second booster, now is the time to think about it, because it will give you your best protection through this second wave for the year. Dr. Griffin also encourages simple hygiene practices which are still effective, including mask wearing, social distancing, hand hygiene, and ventilation. Finally, if you're feeling unwell, stay at home.